helping make your life easier. Moms Every Day.
Hi, welcome to Moms Every Day. I'm Hattie Cheek. James Bales is with us from Cabell Pediatrics. And you know, kids are going back to school left and right here. They've gone back yesterday, the day before. Some are going back next week. So I guess it's time to prepare for them to go there medically, if you ask.
Yes, it is.
All right, so what kinds of things should we be doing before or right now as they are back in school?
Well, it's really important for kids to have back-to-school physicals every year. It doesn't always have to be back to school, but it's certainly, we encourage kids to have physicals every year. A lot of parents will do those at certain times of the year, oftentimes after the kid's birthday. We encourage them to do around the same time of the year, but we do see a lot of kids come right back to school. School's starting earlier and earlier. It's harder to get those in the summer.
And even if they go in for sick routines, I mean, kids are getting sick all the time, you're bringing them in, but they still need to do that whole routine thing.
Right. At sick visits, as pediatricians, we often focus on the problem at hand, whether they have a fever, sore throat, earache, cough. So we really won't address their overall health. Now, when they're here for a routine visit, we really start with from the top and go down. We measure them at first, making sure they're growing appropriately. We make sure they're gaining weight or not gaining too much weight. We check their blood pressure. We just really screen for overall health issues. Parents have questions oftentimes, are the kids ready for school? We can help address that. Do they need referrals for speech therapy or for psychoeducational testing for school? Can we help? We can also address chronic conditions that they may have. Is their asthma under good control? Do they need to be on different controller medications for their asthma? Do they have allergies that they need to be on other medications for that? Those things that we can address all at the routine visits. Teenagers often have other issues with puberty or with acne and things like that we can all address at the routine visit. And just screen for diseases like scoliosis and heart problems and things like that that are important to do every year.
Yeah, so you as a doctor, you're asking more questions when they're coming in for a routine visit versus sick visits anyway. That might even spark something.
Absolutely, and we have a lot of different questions that we want to address at each issue, and looking at career goals and other things like that kids are interested in, and that way you get to know the child a little bit better as well.
All right, and then we need shots before we go to school. What shots do we need? And then what do you think that they should get that isn't necessarily recommended? Well, or at least needed.
Well, what's required for school in West Virginia is assuming there's a series of vaccines you get when you're younger, and then around at age 4 to 5 they get the diphtheria, tetanus, pertussis, and a polio vaccine, as well as the MMR and the chickenpox. And so those are things that are required for preschool, elementary school age. Once they get into middle school, then they get a tetanus booster and a meningitis booster, and then they get that booster again in 11th to 12th grade. So there are things that are also recommended. Gardasil vaccine is a vaccine for prevent cervical cancer, mainly in females, and it's also recommended as a teenager to get that as well. And again, the flu shot every year is a great idea to get. All kids ought to get a flu shot every year.
You like the flu shot. And when should we start getting that? And why do you think it's so important to get it?
Well, the flu vaccines are usually available, usually around September, October, November, that time, sometime in the fall. The flu every year kills about 100 healthy, normal kids in the United States. And so you never know who that's going to be. And there could be very bad strains of the flu every year, some that are more dangerous for kids as well. And so it's something that if you get the vaccine, you're never going to know as a parent that it really helped your kid. But if you don't get it and the kid would have a complication of the flu, it'd be something that would be preventable.
And it just seems so unbelievable that so many people would die of the flu, something that seems so common. It's just tossed around, really.
It is. It's extremely contagious when it's out there. And again, we see outbreaks every year, and there's different strains every year. And they're pretty good about guessing which strains are going to come out each year and then trying to put that in the vaccines to help prevent that. Not perfect, but it's pretty good.
Right. And I've gotten the shot before. I've also gotten the nasal spray. And, I haven't gotten the flu, so I'm not sure which one would be better. Both
of them are effective. The nasal spray is probably the better vaccine. It actually works a little bit longer.
And easier.
It's a lot easier.
I can't imagine a child not liking a shot over the nasal spray.
Yeah, you'd be surprised. There are some that don't want things stuck up their nose.
I can see how some would be like, oh.
Most of them, and I'd certainly prefer the vaccine myself.
Yeah. All right. Well, good information. Lots of advice. And, of course, you are having that back-to-school health event. That is Saturday, August 9th from 11 a.m. to 3 o'clock at the Huntington Mall. So if you guys need any more more information, obviously you can head out there for that event, or you can head to our website, WSAZ.com. Click on that Moms Everyday tab, and also make sure you download our Moms Everyday app. We will be back with more moms after the break. Stick with us.